I'm Jenny Backus, Acting Assistant Secretary for Public Affairs here at HHS, and welcome to our 12th web chat on the Affordable Care Act. The Affordable Care Act is full of important benefits for you and your family that help bring down health care costs, improve the quality of care, and give you more control over your own care. But some details of the bill can sometimes be confusing, so we're here today to try to answer your questions. We invite you all to submit your own questions throughout the course of the web chat today. You can tweet us, and our Twitter handle is @HHSGOV, or you can always email us, and that address is healthreform@hhs.gov. Please keep your questions as short because we may have to paraphrase them. And if we don't have time for your question today, check out our website, healthreform.gov, and you'll find your answers there because we do lots of frequently asked questions. Okay, today we're going to talk about strengthening and growing our healthcare workforce, especially primary care providers. And that's a critical part of ensuring that people get the quality of care that they need when they need it. The Affordable Care Act strengthens the provider-patient relationship and invests in training and development of the next generation of caregivers. Today we have two guests in the studio to help answer your questions. Secretary Kathleen Sebelius of the U.S. Department of Health and Human Services, and Mary Wakefield, Administrator of the Health Resources and Services Administration, which is also known as HRSA. So thank you both. Secretary, you joined a press conference yesterday with Dr. Wakefield and others to announce this initiative, and you talked about this being a big priority for the President. Why is the primary care workforce such a big deal?
Well, I think what the President understands is that you don't have good quality health care unless you have a health care provider, unless you can go to a doc, see a nurse, have the kind of preventive care, wellness care, follow-up care that patients really need. So the pipeline of doctors and nurses and mental health techs is really essential to making sure that all Americans have high-quality care. It's been a huge priority of his from the Recovery Act, which made the first big investment in this administration in workforce. It continued to be a high priority as we talked about the Affordable Care Act, not just giving people access to insurance coverage, but certainly making sure they could see a doctor.
Now, you're from North Dakota, you're from Kansas. I know this has been an issue for rural communities. Talk a little bit about why that is.
Well, primary care providers are really important in rural and urban communities. But in a lot of our rural communities, that is the provider that you have access to. That is that family medicine physician, that nurse practitioner, a physician assistant who's there and really focuses on keeping the community where they're working well, focusing on illness prevention and health promotion, in addition to caring for acute illnesses. So the primary care provider in rural communities, but I'd say in urban communities too, Jenny, is really the individual and the type of provider that is the backbone of keeping our nation healthy.
Okay, you're a nurse as well.
Yes.
I think we have the two highest ranking nurses in the entire administration with you and Marilyn Tavner. So talk a little bit about how this new package that the Secretary helped announce yesterday helps nurses.
The package that she announced yesterday, this particular set of new provisions funded through the Affordable Care Act, have two very important initiatives, if you will, that directly impact nurses, and one of them focusing specifically on nurse practitioners. So one of the announcements yesterday will put an additional $30 million into training programs for nurse practitioners. What's that going to do? Well, that's going to add about 600 new nurse practitioners to the healthcare workforce. But even more important than that, they're primary care nurse practitioners. The other provision that's important to nurses is funding that's available, and that was announced yesterday, to support nurse-managed health clinics. There will be about $15 million that will flow into a set of nurse-managed health clinics that provide training opportunities for that next generation of healthcare providers. Primarily nurse practitioners and nurses, but also within those nurse-managed health clinics, we see other types of healthcare providers educated and trained, social workers, medical students, and others, because typically that clinic is tied to an academic institution.
Okay. Kathleen has a question, so I will ask Kathleen Sebelius it first. My local community health center is often the primary source of care for myself and my families. How will the Affordable Care Act affect my ability to get care at community health centers?
Well, the Affordable Care Act, again, kind of built on what started as a big investment in the Recovery Act, which was to begin to add new sites, update existing community health centers. And it added additional money, additional resources, and now nurse-led health centers. So we are going to make sure that about double the number of Americans will have access to a community health center as now can get their primary care through a community health center, which is a convenient, usually in the neighborhood, primary health home for millions of Americans, about 20 million right now. Our fellow citizens, neighbors and friends can go to a local community health center, which not only provides health care, but often follow-up care. A lot of them have support programs for parents. Some even do job counseling services. It's really a neighborhood support center which also delivers health care. And that footprint will continue to expand under the Affordable Care Act. And that's very good news for lots of Americans.
And just the other thing in her question I was struck by is she wants a guarantee that what she's getting right now won't change. There's been a lot of misinformation about how people's health care changes. So if you get your care at a nursing home now, you can, not at a nursing home, at a community health center, you can still
absolutely. In fact, the resources from both the Recovery Act passed in 2009 and now the Affordable Care Act, there'll be more resources available to not only existing community health centers. In some cases, the existing center is going to have satellite offices, so maybe at a school or maybe in a neighborhood that's not so well served. And in some places, they just need a new center altogether, and those will be created as part of this program. So the existing footprint will be stronger, and we know that there'll be new opportunities for more Americans to access community health centers.
Great. And if I might, just to add to what the Secretary said, those millions of new patients that can be seen because of the Affordable Care Act through the community health centers, we really are talking about millions. Currently, the community health centers support care for about 19 million individuals. With this investment of $11 billion, we're going to see that almost double. We expect that by about 2015, we'll see close to 40 million people whose care can be received through those community health centers. And it is about resources for construction and renovation, and it is about expanding the availability of services at those sites. So when, in your comment, Jenny, when you said, will their health care change? If anything, it can be expanded. So at a site that may not have access to oral health, well, these are new resources that can expand the availability of services. And in addition, as the Secretary indicated, we'll be funding new sites. Right now we have about 7,900 across the country. So there will be new ones coming online, making community health centers even more accessible in rural and urban areas.
Actually, this is a good question that Elise just sent in. I don't know if it's a Twitter question. It's short. It's for you, Dr. Wakefield. Can you please identify the websites for accessing grant information and program information, since you just gave some nice details there?
Oh, sure. And this is for not just the announcement that the Secretary made yesterday, but also announcements about any funding available. Grants.gov. Could it be any easier? Grants.gov. You could also go to HRSA.gov, find information there too. Either site will take you to that information about how to apply for funds.
Okay, we've got probably about 5 or 6 minutes left, so I'm just going to give a couple rapid-fire questions here. I don't have a name on this, but this individual says, I'm a college student interested in becoming a family doctor, but I'm afraid I'll never be able to afford the cost of med school. What help is available? You want to start with you, Dr. Wood?
Sure. So we have, most important, in the program that's nearest and dearest to my heart, the National Health Service Corps. That particular program allows for the repayment of loans or scholarships in exchange for individuals, medical students who choose primary care, nurse practitioners, physician assistants, and other primary care providers to work in an underserved area, and then, as I said, in exchange for that, have loans repaid or receive scholarships even while they're in medical school. Very important program.
And Secretary, you've met some of these people along the way at some of these community health centers. What does it sort of mean for the next generation to have this opportunity?
Well, I don't think there's any question that we have a lot of people who are fearful of the debt that may be incurred through medical school. So having more scholarships, having more loan repayments, and exchanging that for some service in an underserved area is kind of a win-win. Mm-hmm. There's a new trained doc or nurse practitioner or nurse, and we have an opportunity to actually put them for a period of time to work in an area that desperately needs a doctor or nurse. And what we know is that a lot of people, like our current Surgeon General, went through medical school, had her loans repaid through the National Health Service Corps, served in an area in Alabama and stayed in that area, continued to practice medicine, not because she had to, but because she became the health home for lots of people. She became very attached to that community and stayed there, and that experience happens over and over and over again. So it's a great win-win situation. We need more doctors and nurses. Even without the passage of the Affordable Care Act, we have an aging population who will need more health services. We know that we have a retiring group of doctors and nurses, so we've been building this pipeline for some time, and the new assets in the Affordable Care Act and in the Recovery Act just help us to move along at a faster pace. More medical providers are really part of the future.
That's great. I'm going to ask closing thoughts for 1 second. I'm going to take the last question off of our prevention workforce topic today and go to Jerry, who has a question. I'm on Medicare, and I'm going to start with, I think the Secretary is the one to answer this. I'm on Medicare, Jerry says, and I'm worried about losing my physician. How will the Affordable Care Act affect doctors participating in Medicare?
Well, I think, Jerry, there was a lot of unfortunate information put out to seniors during the course of the debate, and one threat was you won't have a doctor any longer with Medicare. Actually, the biggest threat to Medicare doctors right now has nothing to do with the new health care bill, but has to do with a payment situation which has been part of the law for the last 10 years, and Congress has never fixed it. A payment gap that will occur unless Congress gives Medicare providers an update. That bill is pending today in the United States Senate. We are hopeful that the Senate will step up and actually pass the fix that's needed, but immediately we want to go back to the table. The President thinks this needs to be fixed long term, that you can't threaten doctors every year with a cut in pay. We need to make sure that they understand they are the delivery system for 48 million Americans who rely on Medicare benefits. We want a long-term fix. The President's put it in his budget. He's urged Congress to go to the table. So we need the bill passed today and tomorrow by the House and Senate, but then we need to go right back to the table to make sure that Jerry and my dad, who's an 89-year-old happy Medicare beneficiary, don't lose their health care providers, don't have any worries about the fact that those benefits are secure, but also that the providers will continue in the system.
So 30 seconds left for each of you. One last parting thought on, why is this workforce money important, and how does it really translate to an everyday American sitting at home and saying, what does this mean for me?
What it means, I think, and in particular the announcement we made yesterday about the investment in primary care providers, is that hundreds of thousands more individuals across the country will have access to a primary care provider. This is about investing in keeping people healthy, and if they do become sick, in managing that chronic illness far better, far earlier. If it's asthma, diabetes, primary care providers are really the backbone of prevention and keeping the nation healthy. So I can't think of a better message other than we're moving the needle and pointing it right toward keeping people healthy, in addition to caring for them when they become ill. And that's what this investment helps to do.
Secretary?
Well, again, I think as the President has said from the beginning, you can't have a good health care system without good health care providers and without enough health care providers. It's always been a worry. I would say that people have focused on the additional Americans who will have health insurance. But frankly, those Americans are accessing the health system now. They come through the doors of an emergency room, or they wait until they're very sick in order to get help and care. I think the new system will let them access care at a much earlier level, keep them healthy at the front end, and that's really why we need more primary care providers, more nurse practitioners, more nurses, more mental health technicians to really provide that wellness care, that preventive care that we know is better for patients, better for the medical system, lowers our costs in the long run, and frankly, a lot better for the country.
Well, great. Thank you. This has been a great show. And I want to thank you all for joining us today and our two guests, Kathleen Sebelius, Secretary of HHS, Dr. Mary Wakefield, who's the administrator of HRSA, the Health Resources and Service Administration. We hope you got a lot of your questions answered today. We urge you to go to healthreform.gov. You can also check back on healthreform.gov and watch this show anytime you want. So if you have a young person thinking about going into nursing or nurse practitioner or doctor, make sure they watch the show. There's resources available for them. Thanks a lot for joining us, and we'll see you next time. Thanks.